What happened to your body when you eat ginger every day? Eating ginger every day can have various effects on your body, both positive and potentially negative, depending on the quantity consumed and individual factors. Here are some potential outcomes. Ginger has long been recognized for its positive effects on digestive health. Here's how ginger can benefit your digestive system. Relief from nausea. Ginger is perhaps most well known for its ability to alleviate nausea and vomiting. It's often used to combat morning sickness during pregnancy, motion sickness during travel, and nausea induced by chemotherapy or surgery. Improved digestion. Ginger can stimulate the production of digestive enzymes, which can aid in the breakdown of food in your stomach. This can be particularly helpful for individuals who experience indigestion or slow digestion. Reduction in bloating. Ginger may help reduce bloating and gas by promoting the movement of food and gas through the digestive tract, thereby alleviating discomfort. Anti-inflammatory effects. Ginger contains compounds, such as gingerol, with anti-inflammatory properties. Chronic inflammation in the digestive tract can lead to various digestive disorders. Regular consumption of ginger may help reduce inflammation and prevent these issues. Gastrointestinal spasms. Some research suggests that ginger may help relax the muscles in the gastrointestinal tract, potentially reducing the occurrence of painful spasms. Acid reflux and heartburn. While ginger can have a soothing effect on the digestive tract for some people, it might exacerbate acid reflux or heartburn symptoms in others. Individual responses vary, so it's essential to pay attention to how your body reacts to ginger. To incorporate ginger into your diet for digestive health. Fresh ginger. You can add fresh ginger to your meals by grating it into stir-fries, soups, or sauces. You can also make ginger tea by steeping thin slices of ginger in hot water. Ginger supplements. If you don't enjoy the taste of ginger or find it challenging to incorporate into your diet, ginger supplements in the form of capsules or tablets are available. Consult with a healthcare professional before starting any supplements. Ginger candy or chews. These can be a convenient way to enjoy the benefits of ginger and alleviate nausea on the go. Keep in mind that while ginger can be beneficial for many people, it may not be suitable for everyone. If you have specific digestive concerns or medical conditions, consult with a healthcare provider before making significant changes to your diet or supplement routine. Additionally, if you experience any adverse effects, reduce or discontinue ginger consumption and seek medical advice. Anti-inflammatory properties. Ginger is well known for its anti-inflammatory properties, and this is one of its key health benefits. Here's how ginger's anti-inflammatory effects can impact your health. Reduces inflammation. Ginger contains bioactive compounds, such as gingerol, which have potent anti-inflammatory and antioxidant properties. These compounds can help combat inflammation in the body. Pain relief. Ginger's anti-inflammatory properties may help alleviate pain and discomfort associated with inflammatory conditions, such as osteoarthritis and rheumatoid arthritis. Some individuals find relief from joint pain and stiffness when they include ginger in their diet. Digestive inflammation. Inflammation in the digestive tract can lead to conditions like inflammatory bowel disease, IBD, and gastritis. Ginger's anti-inflammatory effects may help soothe and reduce inflammation in the gastrointestinal tract, potentially providing relief from related symptoms. Cardiovascular health. Chronic inflammation is linked to an increased risk of cardiovascular diseases. Regular consumption of ginger may help lower inflammation levels and contribute to better heart health. Immune support. Ginger's antioxidants and anti-inflammatory properties can bolster the immune system by reducing oxidative stress and inflammation, potentially helping the body fight off infections. Respiratory health. Some studies suggest that ginger may have anti-inflammatory effects on the respiratory system, which can be helpful in conditions like asthma or chronic obstructive pulmonary disease, COPD. To incorporate ginger into your diet for its anti-inflammatory benefits. Fresh ginger. Add fresh ginger to your meals by grating it into stir-fries, soups, or smoothies. You can also make ginger tea by steeping sliced ginger in hot water. Dried ginger, ground ginger is a convenient option to use in baking, cooking, or making spice blends. Ginger supplements, available in capsules or tablets, provide a standardized dose of ginger extract. Consult with a healthcare professional before starting any supplements. Ginger oil, ginger essential oil can be used topically for massage or diluted and taken internally. However, it's essential to be cautious with essential oils and consult with a knowledgeable practitioner before using them internally. It's important to note that while ginger can be a valuable part of an anti-inflammatory diet, it's not a substitute for medical treatment for inflammatory conditions. If you have a chronic inflammatory condition or other health concerns, consult with a healthcare provider for personalized guidance and treatment options. Additionally, ginger may interact with certain medications, so it's crucial to discuss its use with your healthcare provider if you are taking any prescription drugs. Ginger is believed to offer immune system support due to its various beneficial compounds and effects on the body. While ginger is not a magical cure for illnesses, it can be a valuable part of a balanced diet that promotes overall health and immunity. Here's how ginger may support the immune system. Antioxidant properties. Ginger contains antioxidants like gingerol, which help neutralize harmful free radicals in the body. These free radicals can damage cells and weaken the immune system. Antioxidants in ginger can help strengthen the body's defenses. Anti-inflammatory effects. Chronic inflammation can suppress the immune system and make the body more susceptible to infections. Ginger's anti-inflammatory properties can help reduce inflammation, potentially supporting overall immune function. Digestive health. A healthy gut is closely linked to a strong immune system. Ginger can aid in digestion and reduce gastrointestinal distress, which can contribute to better nutrient absorption and a healthier gut microbiome. Nausea relief. Ginger is known for its ability to alleviate nausea and vomiting. This can be especially beneficial when recovering from illnesses or during pregnancy when nausea is common. Respiratory health. Some studies suggest that ginger may have anti-inflammatory and antimicrobial properties that can support respiratory health. It may help soothe sore throats and reduce the severity of respiratory infections. Stress reduction. Chronic stress can weaken the immune system. Ginger's soothing properties may help reduce stress levels, indirectly supporting immune function. To incorporate ginger into your diet for immune system support. Fresh ginger. Use fresh ginger in cooking by adding it to stir-fries, soups, and sauces. You can also make ginger tea by steeping sliced ginger in hot water. Dried ginger. Ground ginger is a convenient option for adding flavor and health benefits to baked goods, smoothies, and spice blends. Ginger supplements. Ginger supplements are available in various forms, including capsules, tablets, and extracts. Always consult with a healthcare provider before starting any supplements. Ginger tonics. You can make ginger tonics by blending ginger with other immune-boosting ingredients like honey, lemon, and turmeric. While ginger can be a helpful part of a healthy lifestyle that supports immune function, it's important to remember that maintaining a balanced diet, getting regular exercise, managing stress, and getting enough sleep are also essential for a strong immune system. If you have specific health concerns or a weakened immune system, consult with a healthcare professional for personalized guidance on incorporating ginger or other immune supportive practices into your routine. Nausea and motion sickness. Ginger has a long history of being used to alleviate nausea and motion sickness. Its effectiveness in these areas is attributed to its natural compounds, particularly gingerol. Here's how ginger can help with nausea and motion sickness. Anti-nausea effects. Ginger is well known for its anti-nausea properties. It can help reduce feelings of nausea and the urge to vomit. This makes ginger a popular remedy for various types of nausea, including morning sickness. Pregnant women often use ginger to alleviate morning sickness and nausea during pregnancy. Nausea induced by chemotherapy. Some cancer patients find ginger helpful in managing nausea and vomiting caused by chemotherapy. Postoperative nausea. Ginger may be used to prevent or relieve nausea after surgery. General nausea. Ginger can be used to alleviate nausea caused by various factors, such as illness, motion sickness, or overindulgence in food or alcohol. Motion sickness. Ginger has been found to be effective in reducing the symptoms of motion sickness, which can include nausea, vomiting, and dizziness. It's particularly useful for individuals prone to motion sickness during travel, such as car rides, boat trips, or airplane flights. Ease of consumption. Ginger is convenient to carry and consume when needed. You can take ginger in various forms, including fresh ginger slices, ginger tea, ginger candies, ginger capsules, or ginger chews. To use ginger for nausea and motion sickness. Fresh ginger. You can slice or grate fresh ginger and consume it directly or add it to hot water to make ginger tea. Ginger tea. Steeping ginger slices in hot water is a soothing and effective way to consume ginger for nausea relief. Ginger candy or chews. Ginger candies or chews can be carried with you and taken as needed when you feel nauseous. Ginger supplements. Ginger supplements in the form of capsules or tablets can be taken before or during travel to prevent motion sickness. It's important to note that individual responses to ginger may vary, and it may not work for everyone. If you're prone to severe motion sickness or if you're experiencing persistent nausea, it's advisable to consult with a healthcare provider for personalized recommendations and potential treatments. Additionally, while ginger is generally safe, consuming excessive amounts may lead to side effects such as heartburn or diarrhea, so moderation is key. Heart health. Ginger may have some positive effects on heart health, although it should not be considered a standalone treatment for heart-related conditions. Here's how ginger may contribute to heart health. Blood pressure regulation. Some studies suggest that ginger may help lower blood pressure. High blood pressure, hypertension, is a risk factor for heart disease. The compounds in ginger may have a mild, blood pressure lowering effect, which can be beneficial for individuals with hypertension. Cholesterol management. Ginger has shown potential in reducing total cholesterol levels and bad LDL cholesterol. Elevated levels of LDL cholesterol are associated with an increased risk of heart disease. By helping to lower LDL cholesterol, ginger may contribute to better heart health. Anti-inflammatory properties. Chronic inflammation plays a role in the development of heart disease. Ginger's anti-inflammatory properties may help reduce inflammation in the cardiovascular system, potentially lowering the risk of heart-related issues. Antioxidant effects. Ginger contains antioxidants that can help protect the heart from oxidative stress. Reducing oxidative stress may lower the risk of cardiovascular diseases. Improved circulation. Ginger may promote better circulation by relaxing blood vessels and reducing the risk of blood clot formation. Good circulation is vital for overall heart health. To incorporate ginger into your diet for potential heart health benefits. Fresh ginger. You can include fresh ginger in your meals by adding it to stir-fries, soups, or smoothies. Additionally, you can make ginger tea by steeping ginger slices in hot water. Dried ginger, ground ginger can be used in cooking and baking. It adds flavor and potential health benefits to various dishes. Ginger supplements. Ginger supplements, available in various forms like capsules or tablets, can provide a standardized dose of ginger extract. Consult with a healthcare provider before starting any supplements. Ginger extracts or ginger oil can be used as dietary supplements, but it's important to use them under the guidance of a healthcare professional. It's essential to remember that ginger should not replace prescribed medications or medical advice for heart-related conditions. If you have heart health concerns or risk factors for heart disease, consult with a healthcare provider for a comprehensive evaluation and personalized recommendations. Maintaining a heart-healthy lifestyle, including a balanced diet, regular exercise, stress management, and not smoking, is essential for overall cardiovascular well-being. Ginger may have a role in supporting weight management, but it is not a miracle solution for weight loss. Instead, it can be part of a holistic approach to maintaining a healthy weight. Here's how ginger may contribute to weight management. Appetite suppression. Ginger may help you feel fuller for longer, reducing the overall amount of food you consume. This can be particularly helpful for people looking to control their calorie intake. Thermogenic effect. Some studies suggest that ginger can increase thermogenesis, heat production in the body, and enhance fat oxidation. This means it may help your body burn more calories, albeit to a relatively small degree. Stomach discomfort. Ginger can alleviate digestive discomfort and bloating, which may indirectly support weight management by reducing water retention and improving digestive function. Blood sugar control. Ginger has been studied for its potential to improve blood sugar control. Stable blood sugar levels can help prevent excessive hunger and overeating. Anti-inflammatory properties. Chronic inflammation is associated with obesity and related metabolic disorders. Ginger's anti-inflammatory properties may contribute to better metabolic health. To incorporate ginger into your diet for potential weight management benefits. Fresh ginger. Add fresh ginger to your meals by grating it into stir-fries, soups, or sauces. You can also make ginger tea by steeping sliced ginger in hot water. Ginger supplements. Ginger supplements, available in various forms like capsules or tablets, can provide a standardized dose of ginger extract. Consult with a healthcare provider before starting any supplements. Ginger tea. Ginger tea is a calorie-free beverage that can be consumed throughout the day to help control appetite and reduce snacking. Ginger in smoothies. Adding ginger to your morning smoothie can be a tasty way to incorporate it into your diet. It's important to keep in mind that ginger's effects on weight management are generally modest. To achieve and maintain a healthy weight, it's crucial to focus on a well-rounded approach, including balanced diet. Consume a variety of nutrient-dense foods, emphasizing fruits, vegetables, lean proteins, whole grains, and healthy fats. Regular exercise. Engage in both cardiovascular exercise and strength training to support calorie burning and muscle maintenance. Portion control. Be mindful of portion sizes to avoid overeating. Hydration. Stay adequately hydrated with water or other low-calorie beverages. Stress management. Stress can lead to overeating. Implement stress reduction techniques such as mindfulness, meditation, or yoga. Adequate sleep. Aim for sufficient, quality sleep, as poor sleep patterns can affect appetite and metabolism. If you have specific weight management goals or concerns, consider consulting with a healthcare provider or a registered dietitian for personalized guidance and support tailored to your individual needs and circumstances. Menstrual pain. Ginger is often used as a natural remedy to alleviate menstrual pain and discomfort, commonly referred to as dysmenorrhea. While it may not work for everyone, many individuals find relief from menstrual cramps by incorporating ginger into their diet or using it in various forms. Here's how ginger can help with menstrual pain. Anti-inflammatory properties. Ginger contains compounds with anti-inflammatory properties that can help reduce the inflammation and uterine muscle contractions that cause menstrual pain. Muscle relaxant. Ginger's muscle relaxing effects may help ease the tension and cramping of the uterine muscles during menstruation. Pain relief. Ginger has natural pain relieving properties, which can help reduce the intensity of menstrual cramps. Nausea relief. Some women experience nausea during their menstrual periods. Ginger's anti-nausea properties can be beneficial in alleviating this symptom. To use ginger for menstrual pain relief. Ginger tea. Steeping fresh ginger slices or ginger powder in hot water to make ginger tea is a popular and soothing way to consume ginger during your menstrual period. Ginger supplements. Ginger supplements in the form of capsules or tablets can provide a standardized dose of ginger extract. Consult with a healthcare provider before starting any supplements. Ginger in cooking. Incorporate fresh ginger into your meals and recipes. It can add flavor to dishes and provide potential relief from menstrual discomfort. Ginger chews or candy. Ginger chews or candies are convenient and portable options for on-the-go relief. Keep in mind that individual responses to ginger may vary, and while it can be effective for some, it may not work as well for others. It's essential to listen to your body and adjust your ginger consumption as needed. If you have severe menstrual pain or other concerning symptoms during your period, it's advisable to consult with a healthcare provider to rule out underlying conditions or explore additional treatment options. Additionally, ginger should not be considered a standalone treatment for severe menstrual issues. It can be part of a holistic approach to menstrual health, which may include lifestyle changes, pain relief medications, hormonal therapies, or other interventions, depending on the underlying cause and severity of your symptoms. Ginger may have some potential benefits for blood sugar control and diabetes management, but it should not replace prescribed medications or medical advice. Here's how ginger may impact blood sugar levels. Insulin sensitivity. Some studies suggest that ginger may improve insulin sensitivity, which is important for regulating blood sugar levels. Improved insulin sensitivity means that cells are better able to respond to insulin, which helps control blood sugar. Glucose regulation. Ginger may help regulate blood sugar by lowering fasting blood sugar levels and reducing post-meal spikes in blood glucose. This can be particularly beneficial for individuals with type 2 diabetes. Anti-inflammatory properties. Chronic inflammation is linked to insulin resistance and impaired blood sugar control. Ginger's anti-inflammatory properties may indirectly support better blood sugar regulation. Antioxidant effects. The antioxidants in ginger can help protect pancreatic cells, which are responsible for producing insulin. This protection may help maintain healthy insulin production. To incorporate ginger into your diet for potential blood sugar control benefits. Fresh ginger. You can add fresh ginger to your meals by grating it into stir-fries, soups, or sauces. You can also make ginger tea by steeping sliced ginger in hot water. Ginger supplements. Ginger supplements in the form of capsules or tablets can provide a standardized dose of ginger extract. Consult with a healthcare provider before starting any supplements. Ginger tea. Regularly drinking ginger tea can be a pleasant way to incorporate ginger into your daily routine. Ginger in smoothies. Adding ginger to your morning smoothie can provide potential blood sugar benefits along with other nutrients. It's essential to keep in mind that while ginger may offer some support for blood sugar control, it should be used in conjunction with a well-balanced diet, regular exercise, and any prescribed medications or treatments for diabetes. Always consult with a healthcare provider for guidance on managing blood sugar levels and to determine the most suitable approach for your specific health needs. If you have diabetes or are at risk of developing it, it's crucial to work closely with a healthcare professional to create a comprehensive plan for blood sugar management. Regular monitoring of blood sugar levels and communication with your healthcare team are key components of effective diabetes management. Potential side effects. While ginger is generally considered safe for most people when consumed in moderation as part of a balanced diet, it can have potential side effects, particularly when consumed in excessive amounts or in specific circumstances. Here are some potential side effects and considerations associated with ginger. Heartburn and digestive upset. Some individuals may experience heartburn, indigestion, or upset stomach when consuming ginger, especially in high doses. Ginger's spicy and pungent compounds can sometimes irritate the stomach lining. Mouth irritation. Consuming raw ginger or ginger with a high gingerol content may cause mild mouth or throat irritation in some people. Diarrhea. In large amounts, ginger can act as a laxative and lead to diarrhea. This effect is more likely with excessive ginger intake. Interactions with medications. Ginger can interact with certain medications, including blood thinners like warfarin, antiplatelet drugs, and medications for diabetes. If you are taking medication, consult with your healthcare provider before adding ginger to your daily routine to avoid potential interactions. Allergic reactions. While rare, some individuals may be allergic to ginger and may experience symptoms such as rash, itching, or swelling. Seek medical attention if you suspect an allergic reaction. Increased bleeding risk. Ginger's potential blood thinning effects may increase the risk of bleeding, particularly in individuals with bleeding disorders or those taking anticoagulant medications. It's essential to monitor for signs of excessive bleeding and consult with a healthcare provider. Pregnancy and breastfeeding. Pregnant or breastfeeding women should consult with a healthcare provider before using ginger supplements or consuming large amounts of ginger, as safety in these situations is not fully established. However, ginger is often used in moderation to alleviate nausea during pregnancy. Lower blood pressure. While ginger can lower blood pressure, individuals with low blood pressure or those taking medications to reduce blood pressure should use ginger cautiously to avoid excessive lowering of blood pressure. Gallstone risk. Some research suggests that ginger may increase the risk of developing gallstones in susceptible individuals. If you have a history of gallstones or related issues, consult with a healthcare provider. It's important to emphasize that most people can safely consume moderate amounts of ginger as part of a balanced diet without experiencing significant side effects. However, individual tolerance can vary, so it's advisable to start with a small amount of ginger if you are unsure how your body will react. If you have any underlying health conditions, are taking medications, or are concerned about potential interactions or side effects, it's essential to consult with a healthcare provider before making significant changes to your ginger consumption. Monitoring your body's response and practicing moderation are key to safely enjoying the potential benefits of ginger while minimizing the risk of side effects. Interactions with medications. Ginger can interact with certain medications, potentially affecting their effectiveness or increasing the risk of side effects. It's crucial to be aware of these interactions and consult with a healthcare provider, such as a doctor or pharmacist, before adding ginger supplements or consuming large amounts of ginger, especially if you are taking any of the following types of medications. Blood thinners, anticoagulants and antiplatelet drugs. Ginger has natural blood thinning properties and may increase the risk of bleeding when taken in combination with blood thinners like warfarin, Coumadin, clopidogrel, Plavix, or aspirin. This can lead to excessive bleeding and bruising. If you're on blood thinners, discuss ginger consumption with your healthcare provider and monitor for signs of bleeding. Diabetes medications. Ginger may lower blood sugar levels. When combined with diabetes medications, it can lead to hypoglycemia, low blood sugar. If you have diabetes and take medications like metformin, insulin, or sulfonylureas, consult with your healthcare provider before using ginger to ensure your blood sugar levels are adequately managed. High blood pressure medications. Ginger may lower blood pressure. If you are taking medications to control hypertension, high blood pressure, combining ginger with these drugs can lead to excessively low blood pressure. Regular monitoring and adjustment of your medication may be necessary if you plan to use ginger regularly. Heart medications. Certain heart medications, such as calcium channel blockers, beta blockers, and nitrates, may interact with ginger. These interactions could affect heart rate and blood pressure. Consult with your healthcare provider to discuss potential interactions and monitor your heart health. Antiarrhythmic drugs. Ginger may have mild antiarrhythmic effects. Combining ginger with antiarrhythmic medications could potentially affect heart rhythm. Consult your healthcare provider if you are on antiarrhythmic drugs. Pregnancy-related medications. Pregnant women should exercise caution with ginger supplements or high-dose ginger consumption, as it can interact with medications used to manage conditions during pregnancy, such as gestational diabetes or hypertension. Consult a healthcare provider before using ginger in these circumstances. Anesthesia. Ginger's potential to affect blood clotting may be a concern when undergoing surgery or receiving anesthesia. It's essential to inform your healthcare provider about any ginger consumption if you have a surgery scheduled. It's crucial to maintain open communication with your healthcare provider about all the medications, supplements, and herbs you are taking, including ginger. They can provide personalized guidance on managing potential interactions and adjusting your treatment plan as needed. If you choose to use ginger for its potential health benefits and are taking medications, consider using ginger in moderate amounts and monitor for any adverse effects. Always consult with a healthcare professional before making significant changes to your diet or supplement routine, especially if you have underlying health conditions or are taking prescription medications. It's important to note that individual responses to ginger can vary, and what works well for one person may not be the same for another. If you plan to incorporate ginger into your daily diet for its potential health benefits, it's a good idea to start with small amounts and monitor how your body reacts. If you have any underlying health conditions or concerns, consult with a healthcare professional for personalized advice.